Okay.
It's one question, one answer.
You, if you want to take a question, I'll ask one. Sure. Matthew Lee, Inner City Press, on behalf of the Free UN Coalition for Access. Thanks a lot for the briefing, all of you, many of whom have been in the UN in different capacities. I wanted to very specifically ask about the Ebola, because it seems to many people that this panel was set up based on a perceived delay by WHO of declaring an emergency, et cetera. And, Médecins Sans Frontières, said that it has been very critical of the response, saying that in many of the meetings in Conakry, WHO wasn't there and that they weren't coordinating correctly. So I guess I want to ask specifically, do you feel that you guys will be proposing for them to do a better job coordinating, or there to be maybe some other coordination, either entity or structure? And I'm compelled to ask this to the current president of Tanzania. If you get a chance at the end of this briefing to say anything you could on Burundi, the council is meeting on it today, and so you're obviously have a lot of effect on and views of it, so I'd appreciate that. Thanks.
There are two questions. Early lessons you take away. What are the early lessons we take away? Is it not too early for any lessons? But who's going to say something?
Thank you, Mr. President. It is in fact too early because we're just beginning, not to write our report, but we just begin to be briefed and to begin our work. It is a challenge, this work, because the Secretary General make the panel recommendation that we strengthen, that we can say something about strengthening the national and international health system with our work, and that we can prevent the outbreak of other epidemic and a better response for the international community. But I may say two things. First of all, the first constat, or I don't know how do you say that in English, that we can do is the link between poverty and stage of development and the outbreak of this epidemic, because it has something to do with the weakness of the national health system. And the second is at the global health governance. You mentioned WHO, and there is certainly something to do to better improve the capacity to respond to the outbreak of such crisis. And but we will have a next session in Geneva, and we will be able to listen to the WHO. And there is, as you know, also a panel from the WHO who is studying the institutional aspects of this crisis, and we will certainly take in account what they are going to say about that. But early lessons, I would say, first of all, the link between development poverty and the outbreak of epidemic, and second, the question of the health governance, the governance at the national and international level.
Well, I would very much like to stress what Micheline said about the link between these problems and, of course, these epidemics and possible pandemics and poverty. I mean, we never heard of an Ebola or something, another virus similar to Ebola appear in Champs-Élysées or in Manhattan. So I think if the world doesn't take care of the problem of poverty, these problems will come again and again. And of course, in this particular case, it only really, the alarm bell maybe rang before, but it was only heard when the cases came to the United States and to Europe. So I would say that the question of the national health systems, the improvement in their services, but also other questions that have to do with development, the hygiene, maybe even habits, culture, all of that has to do with the problem. But of course, as it was said before, and I'll just repeat, we are still in the preliminary stages of our discussions. I didn't count, but probably we'll have 5 or 6 meetings. And of course, we'll have to be hearing all the people who were, or all of the organizations that were involved in a deeper way. So I think it's too early to say, well, certainly there were failures, and certainly there were maybe misperceptions, but why and how, it's still too early to say.
Thank you very much, Mr. Chairman. Just very quickly to add my thoughts on the response issue. In a continuum, of course, there is the prevention episode, the detection, and not least the response. And here is, I think, an area that is extremely critical for our panel to be able to ensure that next time around, that there is less of a lag between detection and response, that we are not lulled by the proliferation of forums and organizations that are meant to deal with this problem and have a situation of a paradox of plenty. We need clear line of command and control. If such an outbreak were to happen again, who is going to act and what are the kind of actions to take? Real, concrete, actionable steps. That's what we need.
Burundi. I'm chairing the East African community.
Yep.
What I've done is to dispatch a mission of the foreign ministers of Tanzania, Kenya, Rwanda, and Uganda. They've been to Burundi on the 6th of May. They met the president, they met all the political actors. On the 13th, we're going to have a summit of the East African community to hear a report from the ministers, what they gathered there, what are the proposals, and then we'll discuss as the East African community on how to assist the people of Burundi have successful elections and peaceful elections as well.
Mr. What about the AU chair's pronouncements yesterday?
I'm talking about the East African community. Don't ask about the AU chair, okay?
What about a third? I mean, in the Security Council, one of the members, permanent members, has said that the getting into the Constitution of Burundi is not appropriate. I'm not saying you would get into the Constitution, but is the issue of the third term something that the East African community would talk about, discuss, and have some opinion on?
We have sent ministers. The ministers will report to us, and then we will discuss. Have patience. After the 13th, you'll get information on what we have decided. Okay? Thank you.
Okay.